Welcome back, everybody, to Good Things Utah. This is time to live well with LDS Hospital. I have Crystal Thellin here. She is a nurse from the LDS Hospital Joint Center of Excellence. We're going to ask her what that is in just a second. But first, let's talk about joint replacement. Nearly 1 million people are getting their joints replaced every single year. Yeah. Why is this so common?
So it's just, we're seeing more of it. So we have baby boomers coming out, and so as you get older, there's a good chance that you may have worn out your joints. It's just like tires on the car. There's only so many miles that you have on those before they start going out. The harder, more active lifestyle that you're living, the more likely you are that you're going to have to get those replaced.
What's the most common place to get that replaced?
So mostly hips and knees are what we see the most of, but you can get wrists, shoulders, even fingers joints replaced.
So when you hear total joint replacement, how is that different than a partial, and is that more common?
So they're about sixes. I think we see more of the total joints for sure. Partial joint replacements are usually, for example, it'll be like half the knee. So you kind of have to look at the anatomy of it. So it's kind of hard to explain, but total joint replacement, you replace the entire surface of the joint on both of those. Partial joint replacement is you're doing a portion of it. So 50% or less is when you see partial replacements.
How do you know you need a joint replacement?
You know, that's a really good question, and it's probably a really hard one. It's a very personal question for a lot of people, but I can't tell you how many patients I see in the hospital that tell me, I've been waiting to do this for the last 10, 15 years. I've been pushing it off. And it really gets to a point for them where they feel like they're living with disability. They're not able to keep up with the grandkids. They're not able to do garden work. They're not able to do the things that they love most. And it's finally where they hit that breaking point where they've decided they're finally going to do something about it to get them back to living the healthiest life possible.
Is it constant pain?
It can be, yeah.
You're
absolutely.
feeling it all the time.
Yep, it can be. And everybody's a little bit different. I've had patients that, you know, their pain was only when they were going up and down stairs, but they go up and down stairs a lot. I've had patients that every step they took, they were walking with canes, they were walking with walkers. Or I've had patients that were in wheelchairs for months before they finally just bucked up and did it.
Is this more common for men or women?
You know, it's a pretty close ratios. It's 60 to 40% roughly is what we're seeing here. But I mean, it's an equal opportunity disease and problem that we see.
All right, Crystal, I love the name of where you work there at LDS Hospital, the Joint Center of Excellence. What is that?
So there's a lot of different places that take care of total joints. You can see them pretty much in any hospital, but we focus specifically on total joint replacement and that rehabilitation that's very specialized to that avenue of care. So in our hospital, you see a lot of total joints, but we have a very structured dynamic that's specifically designed to give the best care to these patients. So we have like joint class, for example. So it's a group environment. You won't get that in many other hospitals where they're going to come down to class together. You're not going to be going through therapy alone. You have a group of people and peers that are going through the same process and you're cheering each other on. We have occupational therapy class, and then you also have a second joint class. So you're getting 2 times to 3 times more therapy sometimes than you would at a normal hospital if you were on a med-surg floor.
Well, it's motivating to go through it with someone else and with a large group of people. What's recovery like for total joint replacement?
So one of the best things, you know, there's a lot of fear associated with total joints because there's this belief that it's a really big surgery, it's a really big procedure to have done, which it is. But at the same time, we tell our patients, you know, when they come to my preoperative class, I tell them, you know, you are coming into the hospital with a sore joint that's causing you a lot of pain. When you leave the hospital, you're going to have a sore joint that's still going to be causing you pain, but this pain is going to get better. It's not going to be the pain that's going to continue to get worse and worse and worse. This is the pain that's going to heal. And so it's kind of that mantra and kind of shifting that viewpoint. So a lot of people don't really think of it that way. So we really help our patients heal, and that's ultimately our goal there.
You're changing their quality of life.
Yeah, that's our goal.
This is hope, to feel good, doing all those things you have to do every single day. If you have questions, LDS Hospital has those answers at their Joint Center of Excellence. The website is right there on your screen. Go to our website. We'll link you to all the information, goodforutah.com/GTU. Also a phone number right there on your screen too. Crystal, thank you so much for joining us today. Good information.